Hi everyone, you're welcome to Medsurgify GH. Here we talk about both medical and surgical conditions. So today we are diving into an important medical condition, stroke. So what is stroke? A stroke occurs when blood flow to the brain is interrupted. There are two main types of stroke. These are ischemic stroke and hemorrhagic stroke. So with the ischemic stroke, it causes 85% of death, and this is the most common type, and it's caused by blockage in the blood vessels. And with the hemorrhagic stroke, that also causes 15% of death, and this happens when a blood vessel in the brain bursts, leading to bleeding. What are the causes and risk factors of stroke? One is high blood pressure, diabetes, high cholesterol, smoking, obesity. So the high blood pressure, that's the biggest risk factor. The diabetes too can damage the blood vessels. High cholesterol also leads to blockages. Smoking too increases clotting and damages in the brain, and the obesity too is linked to many health issues, including the stroke itself. Um, Additionally, we have some risk factors that you can't control them. They are the age, gender, family, history, and ethnicity. What are the symptoms of stroke? So, recognizing symptoms of stroke, um, we have an acronym FAST, FAST. So, the F is face. You check, does one side droop when they smile? And the A is arms. Can they raise both arms, or does one side drift down? And the S is speech. Is their speech slurred or straight? And the T is time. If you see any of these signs, call emergency service immediately. So how can you diagnose and treat stroke? So when you reach the hospital, doctors will conduct tests like CT scan or MRI to determine the type of stroke. Treatment can include, so with the ischemic stroke, they may use clot busting medications such as articulase, that's CPA. That's the most commonly used thrombolytic. It must be administered within a few hours of the onset of stroke symptoms. And you have tenecteplase. Tenecteplase, that's the newer agent that may be used easy to administer, as it can be given as a single intravenous injection. What are the mechanisms of action of this medication? So this medication works by breaking down fibrin. The fibrin, that is a protein that helps form blood clots, thereby restoring blood flow to the affected area of the brain. So for the hemorrhagic stroke, surgery may be necessary to repair the blood vessels. Now let's talk about the prevention. One, you have to maintain a healthy diet, rich in fruits and vegetables, and also exercise regularly. At least 150 minutes a week can help, and control your blood pressure and cholesterol levels. And if you are someone who likes smoking and drinking alcohol excessively, you have to reduce them. And don't forget regular health checkups. So finally, understanding stroke is vital. Early recognition and treatment can save lives. If today is the first time you are watching me, remember to follow me, share my video, and comment for more health teachings. Thank you.
Clarity can fade, a smile droops, a hand betrayed. Words get tangled, thoughts unwind, a sudden weakness, a loss of mind. The world spins fast, shadows creep, and silent secrets we try to keep. A call for help, but who can hear? Time stands still, drowning in fear. Stroke of fate, don't lose your fight. Face the signs, seek help tonight. Numbness creeping, visions blurred. In this battle, be heard, be heard. Every second counts, don't wait too long. Find your voice and stay strong. Confusion lingers, balance slips, a dizzy spell, life's cruel twists, thoughts like clouds drifting apart, a heavy weight upon the heart. The past feels distant, future unsure, but in the storm we must endure. Hold on tight, don't let go, through the darkness let courage grow. Stroke of fate, don't lose your fight, face the signs, seek help tonight. Numbness creeping, visions blur.